Dr. David Rosenberg, a Detroit psychiatrist, has spent his career researching and treating mental illnesses in children and adolescents. He has earned national praise from his peers for his groundbreaking work with Wayne State University and Children's Hospital of Michigan.
Childhood depression, in contrast to the myths, is one of the most treatable illnesses if we catch it early. But the problem is so often the signs and symptoms are missed, and it gives these symptoms time to reap potentially tragic repercussions. And one of those obvious signs is suicide. Depression is the most common underlying cause of suicide, and yet we know that teenagers often tell their friends or peers about being suicidal. Over 80% of children who commit suicide have told a friend or someone else within a week or two of committing suicide. So we as a society, we as students, teachers, parents, doctors, physicians, we need to make sure that we're listening to these cues and acting and intervening. As short as 5 years ago, there were certain schools when we would talk with them as, no way, we don't want any part of psychiatry, psychology, steer clear of us, you're going to give kids the wrong idea, they're going to get it into their head to have suicide, all kinds of problems, we don't want any of these issues. And we had principals and school groups say, stay out of sight. Good news is with the foundation work, the commitment of the Children's Hospital, Wayne State, is that's really turning around almost 180 degrees, whereas in the past there was skepticism and outright fright, we don't want you. Now we're being welcomed more often than not with open arms. I think there is an improved and enhanced understanding. We've seen that there are a lot of terrific programs, and what was surprising, though, is that sometimes the students were totally left out of the equation, and they're the ones, the peers, who we really have to communicate with and let them know that, look, we realize that we may not be the people you always want to share this with, but we're here. There's secrets that are good to keep. You know, so if so-and-so has a crush on somebody and your friend asks you to keep a secret, that might be a nice secret to keep. But if somebody's talking about wanting to end their life, they're talking about being hopeless, about their situation at home, being desperate, that's not a secret to keep. You're not being a friend, even if your friend says, I'll never speak to you if you tell anyone. That's a secret to break, and I think you should risk it because the alternative is so scary. The alternative is so final. The alternative is death. And so if you're wrong by breaking the secret, the person lives. If you're wrong about not breaking this secret, your friend could die. We know that knowledge is what heals, and knowledge is what defeats ignorance, and ignorance leads to stigma because we're frightened. We talked about how in the past, if you had tuberculosis, you'd be locked up in a sanitarium. Why? Because people were afraid of getting infected and ill, and we didn't know as much. When we learned about treatments, we now can treat that very effectively. I think with this example of the teenager who had a very serious suicidal depression. We had to hospitalize him. We put him on intense therapy and medication, and he responded marvelously well. Had a dramatic response, and yet I was paged by his mother because word had somehow gotten out that he'd been in a psychiatric hospital. It's tragic when you think about somebody fighting a devastating medical illness and then has to confront this on top of it, where he's conquering his depression, he's living with it, and due to the stigma, the ignorance, has to confront this. I think that if he had broken his arm, the kids would be lining up to sign his cast. We're now beginning to learn with some of our brain research that there are specific areas of the brain that aren't functioning properly. And what's more, with effective treatment, medicines, non-medicine therapy, their combination, we can sometimes reverse these alterations. So very, very exciting. There's no question that this has a biological basis like any other medical condition, and we find that that form of communication is extraordinarily effective. There have been such exciting developments in treatment, both with medication, therapy, that we know more about illnesses like depression. Childhood depression, in contrast to the myths, is one of the most treatable illnesses if we catch it early.